FDA is signing off on the first prescription digital treatment for depression.
It's a smartphone app called Rejoin for people diagnosed with depression.
Now, it's only available by prescription, and it should be available later this year. Very interesting. UW Health's Dr. Jeff Pothof is here to tell us more about it. Nice to see you, Dr. Pothof. I don't think I've ever heard of a prescription app.
Yeah.
That's because I don't think there's ever been a prescription app before, but this would be the first. I think it's an interesting approach. The science behind it is there's a lot of people who suffer from major depression. Some people get better just with medicines, but some people even on good medical therapy just don't get better. So there's research into whether if we show people pictures of different emotions, have them kind of call out that emotion, remember that emotion, it can trigger kind of neural connections in two parts of the brain called the amygdala and the dorsolateral prefrontal cortex. Those names aren't important. And there's small studies that show that maybe that works. We're not sure. This app basically provides you those pictures that you look at, has you kind of recall them, and it just got approved by the FDA as an adjunct to help treat people with major depressive disorder.
So this is not to replace medicine or talk therapy with your therapist or anything like that?
Not at this point, and even at this point, the bar that the manufacturer needs to clear to get approval is pretty low. Like, there really isn't anything out here. It's just an app, so there probably isn't much harm related to it. In the study that they compared this app to a sham app, there was actually no difference in how much people improved in their depression. So we're not even 100% sure that this app works, but I do think the interesting thing is more so that we could have apps that are sophisticated that can almost act like therapists in the future, just using a phone, which would be great, but we got to make sure they work well.
Which is interesting because I think a lot of times people that suffer from major depression isolate themselves and already have too much screen time. So now you're finally using the screen for something potentially beneficial. And is it significant that the FDA is approving a non-drug treatment? Is this the first non-drug treatment for major depression?
I mean, I think as far as like something that's FDA approved that's digital and on your phone, I've never heard anything else, and I don't know where you would even go to get your prescription app. I'm not sure that's in the Apple or the Google Play Store.
Right.
But it is an interesting kind of idea that we might see these kind of treatments on our devices in the future.
Have you ever even heard from any of your colleagues who are like, I'm intrigued, maybe I might partake in this or suggest this to my patients?
Oh, not yet, but at the same time, like, I haven't talked to any psychiatrists in the last couple of days either, but I think there will be healthy suspicion on whether or not this is going to be helpful for folks or not. At the same time, I could see a patient who's got major depressive disorder, they're doing everything they can do, nothing's working. Maybe there isn't a lot of risk in saying, hey, let's try this, see if it helps you out. I think as long as you disclose to the patient, we're not sure if this will work or not.
It's early on, and we'll continue to follow it, but it could potentially offer hope. What is it, 21 million people in the U.S. suffer from major depression?
Big group.
Yeah.
Big group.
Yeah.
So for people, since we are talking about depression and this app, it's just so new, it's not really highly recommended at this point. What can people do right now?
I think the most important thing related to depression is recognizing that you have it, talking to someone about it. We still stigmatize depression, mental health so much that people are almost afraid to like step out and ask for help. I think that's the #1 message is if you feel like you're depressed or life just doesn't have a lot of joy to it, that's not something you just got to figure out on your own. You got to reach out to your primary care doctor or at least to someone to say, hey, I'm not doing okay here, help me out. Depression is a disease just like heart attack, just like stroke. We need to treat it that way too.
Very important message, very reassuring too. Good to see you, Dr. Pothof.
You bet.
We'll see you next week.
Thank you.